Hi, I'm Dr. Suzette Glassner, clinical psychologist and associate professor of psychiatry at UCLA. Today, I want to spend some time talking about what I'm referring to as the addiction no one talks about. And it's not quite literally true that no one talks about it, but it's certainly taken a bit of a back seat in terms of where the media headlines have drawn most of our attention in relation to the problem of addiction as a public health issue. And what I mean by that is that the front seat in the media headlines around addiction is mostly occupied by the opioid overdose crisis. And quite rightfully so, the opioid overdose crisis warrants significant attention from a public health perspective. And I've spent quite a bit of time in my last few podcast episodes talking about the opioid epidemic, the way that it's affecting young people, some of the risk factors for involvement in opioid use among young people, some of the ways that young people are accessing opioids or other substances that are laced with potent and lethal opioids such as fentanyl. But there's one thing that we don't want to lose sight of, which is that the addiction that is probably less frequently the focus of media and other attention, which is alcoholism or alcohol use disorders, actually occurs with much greater frequency in the population than opioid use disorder. So we know that alcohol use disorder affects 7 times more individuals than does opioid use disorder. Again, both of them are worthy of attention, but I'd like to focus on the subgroup of individuals that is suffering from a disproportionate impact of problems related to alcohol use and the health-related consequences of alcohol use. And you may or may not be surprised to learn that that subgroup is women. So just taking a step back, in general, research has shown that 20% of deaths among individuals between the ages of 20 and 49 are accounted for by alcohol use. And that's a pretty staggering figure. So just in general, women aside, knowing that alcohol-related problems are behind these mortality rates in 1/5 of the population in that age range between 20 and 49, certainly the problem of excessive and harmful alcohol use really warrants some special and focused attention that I'm going to provide today. And I'd like to focus on what we understand about the health risk in particular to women, because many people don't know that alcohol misuse among women is on the rise. And misuse doesn't necessarily mean addiction, but misuse can certainly lead to addiction. It doesn't always lead to addiction, but misuse means using excessive amounts of alcohol that can place an individual at risk in some form, at health risk, at risk of developing an addiction, that poses safety risks, etc. And we're seeing this happening more and more among women. And certainly we could trace some of this back to COVID, where women were juggling multiple obligations and role identities in a more sort of prominent way than usual, by trying to balance work and household obligations and schooling children at home, etc. But we do know that not only is alcohol use and misuse among women increasing, but collectively, what we know from research about the effects of alcohol on women physiologically and psychologically are that, first of all, women are generally more vulnerable to the long-term adverse health impacts of excessive alcohol use. So what that means is that if a woman and a man start drinking and drinking problematically around the same time in life, the woman is more likely to develop medical problems related to her alcohol use sooner in life than the man. We also know that women die of alcoholism at a younger age than men do. We also know that women have a greater risk of developing alcoholic liver disease than men, and that they also develop a condition known as cardiomyopathy, which is a disease of the heart muscle that makes it much harder for the heart to pump blood to the rest of the body. And that happens to women after fewer years of drinking drinking than it happens to men. So both men and women are vulnerable, obviously, to the health impacts of excessive alcohol use on their liver, on their heart, and then the risk of breast cancer among women who drink just one alcoholic beverage per day is between 5 and 9% greater than those who don't. And for every additional drink that they consume on each what we call drinking day, the risk of developing breast cancer incrementally increases. Another health impact that is recognized from the research literature on women of alcohol use is that they actually experience brain changes. So, for example, a loss of brain volume and cognitive problems from alcohol at a more rapid rate than men. All signs point to the fact that women develop health problems earlier in the course of their alcohol use disorder than do men, and they are vulnerable to a variety of health-related consequences from alcohol use at higher rates than men, or they're at greater risk than men of developing some very specific alcohol-related health difficulties affecting their liver, their brain and cognitive functioning, and of course the risk of breast cancer. So it'd be natural to wonder, why are women disproportionately impacted by these health impacts of alcohol use in this manner? Because it is pretty striking the way in which they are affected. And we understand this to be related to the way in which their body absorbs and distributes alcohol. So we know that generally women weigh less than men, and we know that alcohol resides in body water, and that pound for pound women have less water in their bodies than men. So what that means is that a man and a woman of identical weight consuming the same amount of alcohol will have different blood alcohol concentrations, because this is so closely related to the presence of alcohol in the body's water. Since women have less of it, that means that with the same amount of alcohol compared to a man, the woman's blood alcohol concentration is going to be higher. And so when your blood alcohol concentration is higher, you can think of it as something that has the potential to be toxic to the body, is becoming more concentrated in the body of a woman than a man, and that is placing her at greater risk for harms related to alcohol use. And this is sort of the general concept that we understand to be tied to this heightened risk that women experience for health-related complications from alcohol. We also know that, consistent with this idea that their blood alcohol level is impacted differently and more severely, more rapidly in a way than that of men, that some of the acute and short-term effects that people who drink heavily or large amounts of alcohol in one sitting experience, such as hangovers and alcohol-induced blackouts, those consequences are more likely to impact women than men, which actually makes a lot of sense if you think about these different ways in which their bodies are processing and accumulating alcohol. And of course, there could be other biological differences. Okay, so we've talked about the rise in misuse of alcohol and alcohol use disorders among women relative to men. We've talked a little bit about the specific types of health consequences that women are vulnerable to at higher rates than men, or earlier on in the course of their relationship with alcohol and alcohol use than men. We've talked about why, from a physiological, biological perspective, this might be the case. Now let's talk a little bit about what it is that places women versus men at risk for developing an alcohol-related problem, so that if you or somebody you know or love has started to become involved with alcohol use or more heavily involved with alcohol use, you can know sort of what the signs are to look out for, or some of the characteristics of that individual to look out for, in being able to predict whether they are more likely to develop an alcohol-related problem. And then that way you can tune in a little bit more closely to what is happening as a result of their drinking that may not be so beneficial, if anything. So for women, we know that there are 3 predictors of the development of an alcohol use disorder among women that are observed more frequently among women than men. The first is a family history of alcoholism. The second is experiencing an anxiety disorder early in life. And just for context, the different types of anxiety disorders that could account for this include generalized anxiety disorder, panic disorder, post-traumatic stress disorder, and obsessive compulsive disorder. There are also other anxiety disorders such as phobias that you can look out for, but generally any anxiety disorder relatively early in life is predictive of a heightened risk or a higher risk of developing an alcohol use disorder for a woman. And then finally, the third one is addiction to nicotine. So if you or someone you love who is a woman is addicted to nicotine, has been diagnosed with an anxiety disorder early in their life, and has a family history of alcoholism, that's a person who would need to be really vigilant about their relationship with alcohol so that they can recognize the signs and symptoms if something's getting out of control. Someone with any of those risk factors, because you don't have to have all of them to be at heightened risk, it could be any of them, who is a woman, might want to think about living life alcohol-free. Just a thought, not a requirement. For men, the characteristics that predict a stronger risk of alcohol use disorder are actually very different. It's pretty interesting. So first, a thrill-seeking or what we call novelty-seeking personality trait, somebody who really likes to seek out novel kinds of experiences that make them feel good, sort of a more adventurous type of person, someone who's really seeking experiences that create some of those positive emotions and some of that sense of excitement. That's one predictor. Another is having behavioral and emotional problems during childhood and adolescence. And the ones who tend to be a little bit more at risk are those that have experienced what we know as conduct disorder. And conduct disorder is a pattern of behavior that starts in childhood involving aggression and disregard for the feelings of others, a lot of kind of seemingly rebellious and sometimes criminal-like behavior, often diagnosed in childhood as oppositional defiant disorder and later on potentially as conduct disorder, is another risk factor for developing a problematic relationship with alcohol. Childhood sexual abuse is another risk factor, and then some traumatic experiences such as a loss of a parent and low self-esteem. And then finally, in adulthood, dissatisfaction with one's marriage is a predictor among men of developing an alcohol use disorder or having a heightened risk for developing an alcohol use disorder. So why is all this information useful? Well, first of all, understanding the factors that place a person at risk can just lead you to be more vigilant about your relationship with alcohol or that of a loved one, so that if you observe any signs or symptoms of loss of control, or if you're concerned that you or someone you love or care about is starting to drink more heavily and doesn't seem to be completely in control of it, you can sort of think about some of those risk factors and whether you could explain some of that with the knowledge that that person might be especially vulnerable to developing a problem with alcohol, and then maybe studying a little bit more about what that would look like, talking to a trusted healthcare professional about it. In one of my upcoming podcasts, I'm going to talk about the treatment options. A lot of people don't even know that apart from behavioral therapy, there are very effective medications for the treatment of an alcohol use disorder, or even to help the progression of a mild alcohol use disorder into something really serious. So there are a lot of things that you can do if you are concerned about these signs and symptoms. Another thing to be aware of, especially if you're somebody who has tried to stop using alcohol or has stopped using alcohol or changed your use of alcohol recently, that the things that lead men and women to fall back into problematic patterns of alcohol use that they were trying to get away from, either by quitting or cutting back, are actually very different. So whereas women tend to be more vulnerable to relapsing to old patterns of alcohol use when they're trying to achieve some type of recovery from their alcohol use disorder or just trying to change their alcohol use, they typically will be more likely to slip back into these old patterns in response to some type of emotional trigger, some type of internal negative emotion that they're experiencing that they're trying to medicate with alcohol. So if they're feeling depressed, if they're feeling anxious, men, on the other hand, tend to be at greater risk of going back to old patterns of behavior when they're looking for a pleasurable experience or when they're in social situations. So just a couple of things to bear in mind. And what can you do about that? In my first book, the Addiction Recovery Skills Workbook, you might want to take a look at some of the coping strategies that I describe for coping with triggers, because those are what we call internal versus external triggers. Internal triggers are emotions or the desire for a particular emotion. External triggers are things that are in our environment that tempt us to drink or use other substances and can include social pressures. So men may be more vulnerable to social pressure. Women may be more vulnerable to internal triggers such as depression or anxiety. And if you know that about yourself, then you can start to equip yourself with coping strategies and plans for if you're feeling any of those ways or encountering any of those triggers. What can you plan in advance to do in order to prevent yourself from falling back into those old habits? So definitely pick up the Addiction Recovery Skills Workbook if you're curious about that. And on this topic of women and their vulnerability to alcohol use disorders, my new book that is coming out very soon, Addiction: What Everyone Needs to Know, covers this topic in greater detail. In my next podcast, I plan to talk more about some of the treatments that are available for alcohol use disorders. So thank you so much for joining me today, and I hope to see you then.